Hello friends, welcome to Physiotherapy Pathshala. Here I am Devanshi Shah and today we are going to talk about the osteoporosis. So the word itself means that osteoporosis is the porous bone. So it is a bone weakening process or condition. This is the very major metabolic disease nowadays and it is actually asymptomatic in nature in the early stage of life. Okay. So today we are going to cover these contents and we will start with the introduction of the osteoporosis. So first we will learn the definition. WHO has classified this definition that it's a skeletal disease which is characterized by low bone mass that leads to enhanced bone fragility and consequent fracture risk. So it is basically low bone mass. There is decreased bone density in this disease and that will lead to enhanced bone fragility. Okay, so there will be imbalance between the osteoblastic and osteoclastic activities. What is osteoblastic? So there are the cells in our bone that forms the bone and there are the cells that will reabsorb the bone. So there will be two types of activities. So in osteoporosis, in normal individual, there is balance between these both activities. In osteoporosis, as the aging process start, osteoclastic activities will increase. So that will lead to osteoporosis. Okay. So as I earlier told you, it is asymptomatic in nature. Okay. In this figure, you can see you can differentiate the healthy bone and the osteoporotic bone. Okay. So next we have the pathophysiology of the osteoporosis. So basically due to some reason there will be deficiency of calcium and vitamin D in our body. So deficiency of these things will cause the absorption of calcium from the intestine. Okay, so there will be release of parathyroid hormone from the parathyroid gland that will stimulate the reabsorption of calcium from the bone. So that will encourage the osteoclastic activity and that will lead to osteoporosis at the end. Okay, I hope you got it. So here you can see the stages of the osteoporosis, how the trabecular system, how the bone will appear. Okay, these are the four stages: normal bone, osteopenia, osteoporosis and the most severe osteoporosis. Okay, so now this is the classification of osteoporosis. It is classified into two, primary and the secondary. So primary, it is basically idiopathic. First is the postmenopausal osteoporosis and other is senile osteoporosis. In postmenopausal osteoporosis, there are the women that when they cross the menopause, there will be deficiency of estrogen. So basically estrogen helps the osteoblastic activity, that enhance the osteoblastic activity. So due to cessation of estrogen hormone, there will be lack of osteoblastic activity in the bone. So that may lead to osteoporosis in future. Okay, so that is also important cause. And another is senile osteoporosis. So it starts with the aging process. As the age increases of a person, there will be decrease in osteoblastic activity overall in our body. There will be increase in osteoclastic activity that will lead to osteoporosis. Okay, and another is secondary osteoporosis. So it may be due to some underlying primary cause, which may be due to some disease, endocrinal disorder or malignancy, and like diabetic mellitus, Cushing syndrome, Klinefelter syndrome, etc. And there can be caused due to intake of certain drugs like glucocorticoid or some type of steroids and other antileptic drug or heparin that may lead to osteoporosis in future. Okay, so let's move to another slide, clinical features. Okay, so these are the ideal clinical features. Pain, so there will be pain over the, primarily there is most commonly pain over the dorsolumbar spine, and pain can also refer to the hip joint or the prime or the proximal radioulnar joint. Okay. And there will be history of compression fracture of, or it can be vertebral fracture. Okay, there will be kyphotic hump deformity. As you can see the classical image of the osteoporosis in this figure, there is kyphotic hump which is visible. Okay, there will be early fatigue, and the patients with osteoporosis are more prone to fractures because their bones are already weakened. Okay, and there will be also increased lumbar lordosis in these patients. Okay, so now we are going to take a look about the risk factors. So there are two types of risk factors: modifiable, that can be modified by giving some drugs or lifestyle modification. Okay, so they are the hormonal deficiency of the estrogen. There will be primarily deficiency of the estrogen. Okay, another is nutritional deficiency. As I earlier told you, there will be deficiency of vitamin D3 or calcium. It may lead to osteoporosis. Sedentary lifestyle, so that can also be important risk factor. Postmenopausal state, as I earlier told you, there will be lack of estrogen hormone, so that may lead to osteoporosis. Disease of the liver, as I earlier told you, that liver will need calcium, and that may lead to osteoclastic activity to the bone, and long-term immobilization can also affect. Okay, and these are the non-modifiable factors, that is positive or family history that you can't change, and history of repetitive fractures, and age above 50 or 55, that are the most chances of the osteoporosis. Okay, so it is the diagnostic technique. First is the radiograph, another is the DEXA scan, which we can also perform. Actually, it is a dual energy X-ray spirometry. Okay, I will discuss it in later slides. Another is MRI scan. On MRI scan, we can detail the pattern of bone trabecular system, and on that we can suggest the stage of the osteoporosis. Okay, and another is physical examination, that we can see the kyphotic hump and lumbar lordosis and pain and compression fracture. Okay, so here we have an image of radiograph of osteoporotic lumbar spine. Here you can see the arrows. There is loss of height of the vertebral bodies. Okay, another we have okay, by the help of DEXA scan we will find out the bone mineral density. So what is that? It is the amount of mineral matter per square of bone, and it is measured by the DEXA scan. Okay, so it is there are the two scores that we will gain. There will be T score, so it is the score of the individual and the healthy person of the same sex. Okay, so for example, we have a patient of 70 years old female, so her BMD will be compared with the healthy and young, like 30-year-old female, and that we will gain the T score. Okay, so these are the normal parameters. So in normal bone, T score will be greater than or equal to -1 standard deviation. So in if that person has osteoporosis, his T score can be less than or equal to -2.5 standard deviation. Okay, so we can find out with the help of DEXA scan. Okay, now we are leading to the management part. So these are the main points. It is a multidisciplinary teamwork. We have to check it out after 50 years, and we should give good nutritional diet. We can also perform hormone replacement therapy. Physiotherapy management is always there, and surgical procedure also. Okay, so first, for good nutrition we will provide the vitamin D. Here are the sources. We have milk, paneer, cheese, egg, peas, meat. Okay, so that can also increase the amount of vitamin D in our body. So these are the guidelines. First, we have to increase adequate intake of calcium, supplementation of vitamin D. We have to increase protein intake, that will also help to bone, that will also help to increase bone density. We can also start aerobic activities like jogging, cycling, because weight bearing also helps to form good density of the bone. Then if the patient is on smoking and alcohol, then that will be cessation of that, and prevention of falls should also be taken care of, and prevention of refracture. Okay, so these are the pharmacological treatment. First is the anti-osteoporotic drug, that is biphosphonate. It will work as a osteoclastic agent, anti-osteoclastic agent. Another, we have vitamin D. We will provide it with cholecalciferol. We can also perform hormonal replacement therapy. We can give estrogen or with the combination of progesterone also. Okay, so there are also surgical procedures like vertebroplasty and kyphoplasty. In vertebroplasty, we will directly inject the bone mass bone mass into the vertebra, but it is quite unsafe. This is the kyphoplasty procedure, and it is quite safe compared to vertebroplasty, because there will be, you can see in this video, that we will percutaneously inject a tube into the affected vertebra, and that will inject the balloon inside, and that will inflate and release the bone inside. Okay, so it is quite safe. It is done by inserting a balloon percutaneously and is then inflated, injecting cement into it. Okay, so it is quite safe than vertebroplasty, and the balloon has injected so that the chances of cement linking out of that, it is less common. Okay, so yeah, so we can now move to the physiotherapy point of view. Okay, these are the physiotherapy guidelines that we will follow. First, we have to educate the patient, educate the pharmacological management, what the condition that he has, and what nutrition value that he should take, like vitamin and calcium, etc. Okay, so also we have to teach the correct lifting techniques. As she is a housewife, she has to lift something from the ground in on daily routine. So we have to teach him lifting techniques, like if she has to take something from the ground, then she should sit or squat instead of bending down. That will give less pressure or less strenuous activity to the spine. Okay, we have to manage pain with the pain relieving modalities. We have to teach some postural correction that we will cover in the following slides. We have to teach strengthening exercise. We can also start aquatic exercise, and walking is most important for the patient with osteoporosis. Okay, so these are the exercise, shoulder mobility exercise. So you can see this in figure, that patient is in supine, so his scapula and spine is fully supported. That will help to improve the posture also, and that will also provide stability. Okay, and flexion of the hip and knee will relax the lumbar curvature. As I earlier told you, there will be kyphotic changes in the thoracic spine, and there will be increased lumbar lordosis, so that will also get relaxation. Okay, another image we have to stretch pectoral muscles. As I told you, there is a kyphotic deformity, so there will be tightening of the anterior structures like pectoralic muscle, so that should be stretched regularly. Okay, so we can also stretch them with some breathing exercise. So as the patient stretch the pectoralis, he will breathe in, and as he relaxes the muscle, he should breathe out. So that will also improve the chest expansion, because kyphotic deformity may lead to less chest expansion. Okay, so we have to figure it out. Then another image we have, that is back extension exercise. There will be weakness of the back extensors, so we have to must concentrate on strengthening of the back extensors. So we will start with the back extension exercise with the pillow under the abdomen, and the patient will have to extend his back. Okay, another image we have strengthening of the lumbar extensors and the gluteus maximus. These both are very important to maintain the posture, so that also important. Okay, so these are the postural correction techniques. So we have to specifically work on the kyphotic posture. Here you can see there are task modification, and we should also teach the patient about that. Okay, how to work on a desk. He should take a full support of a chair. Okay, for lifting, I earlier told you that he should squat and then lift, unless he should not lean forward. Then okay, I hope it is clear to you. Then these are the orthoses. As I hope you know that there is thoracolumbar support and ASH braces are available, that will help for the hump or the kyphotic deformity. Okay, here we end. Thank you. And if you like this video, you know the drill. Like, share and subscribe. Toodles.